Sexuality in old age is a subject often surrounded by taboos, but it is essential to address sexual well-being as an integral part of health at all stages of life, including the elderly. From a scientific perspective, there is no universal, ideal frequency for sexual relations in older people, since sexuality depends on many factors such as physical and mental health, relationships, personal desires, and emotional well-being. However, various studies have pointed out that maintaining an active sex life can contribute to a better quality of life, promoting cardiovascular health, self-esteem, and emotional well-being. Instead of focusing on the number of times you should have relationships, the key lies in the quality of sexual experiences and open communication with the couple. Lubrication, for example, can be a relevant aspect in the sexuality of the elderly, due to hormonal changes. But there are solutions such as water-based lubricants that can facilitate sexual act and make it more pleasant. In addition, research has shown that physical contact and intimacy continue to be a source of pleasure and emotional connection for many older people, regardless of frequency. The most important thing is that people feel comfortable, safe, and accepted in their desires and in their bodies, and that sexuality is practiced in a consensual, respectful, and healthy way. Sexuality in old age should not be seen as something reserved only to youth, but as a valuable and natural part of life that can continue to be enriched and transformed over the years, provided that healthy habits, communication, and an attitude are maintained positive. It is crucial to understand that, over the years, people may experience changes in their libido or their sexual needs, but this does not mean that sexuality should be excluded from everyday life. Instead of thinking about sexuality as something that decreases with age, it should be considered as an evolutionary part of adult life, which adapts and changes according to the desires and limitations of each individual or partner. As we age, sexuality can become a more emotionally connected act, where intimacy and love become as important as physical pleasure. In addition, maintaining an active sex life in old age is associated with an improvement in cognitive function and a decrease in stress, which favors general health. It is important to remember that not all older people have the same vision or desires regarding sexuality, so the key is an individualized approach. Opening and understanding by couples are essential to explore new forms of intimacy, adapted to mutual needs and desires. In some cases, the use of medical therapies or treatments can be useful, such as those destined to improve sexual function, which can help those who face health-related difficulties. However, dialogue and empathy remain the most powerful tools to promote healthy and satisfactory sexuality. Finally, promoting a positive attitude towards sexuality in old age helps eliminate stigma associated with the idea that sexual desire decreases or disappears with age. Actually, old age can be a stage of rediscovery and openness to new experiences, where mutual well-being and respect play a fundamental role. By focusing on enjoyment and understanding of changes, sexuality in the third age can be as rewarding as in any other stage of life, demonstrating that age is not an obstacle to an active, healthy, and full sexual life. In addition, it is important to recognize that, with age, physical changes can influence how people experience sexuality, but this does not have to be an impediment to enjoy a satisfactory sex life. For example, the decrease in hormonal levels in women during menopause can lead to changes in vaginal lubrication, which could make sexual relations less pleasant if appropriate precautions are not taken. In these cases, the use of lubricants and other solutions recommended by health professionals can be key to maintaining an active and painless sexual life. Similarly, men may experience a decrease in erectile function, but this can also be handled through medical treatments or adaptations, such as the use of erection devices or specific medications. In addition to physical factors, emotional and psychological aspects also play a vital role in sexuality in old age. Trust in the couple, open communication on desires and limits, and respect for the emotional needs of the other are fundamental to maintain a satisfactory sexual relationship. It is not just about fulfilling a certain frequency, but to create a safe space where both members of the couple feel comfortable exploring their sexuality and maintaining the emotional connection that goes beyond the physical. Sexual well-being is also closely linked to mental health. Stress, anxiety, and depression can negatively affect sexual desire, so maintaining an integral approach to health is essential. Promoting activities that reduce stress, such as exercise, meditation, and socialization, can have a positive impact on libido and the quality of sexual relations. The relationship between physical and emotional health in old age is so crucial that, in many cases, improving general well-being can result in a rebirth of sexual life. Finally, it is essential to eliminate the wrong idea that sexuality is exclusive to young people. Older people also have the right to enjoy their body and desires. Sexuality in old age is a natural component of human life, and it is crucial that, as a society, let's continue challenging the prejudices and stigmas associated with this issue. In doing so, we not only improve the quality of life of the elderly, but also encourage a more inclusive and respectful culture with all aspects of human existence. Sexuality is a part of life that should not be lost over time. On the contrary, it can remain a source of satisfaction, intimacy, and well-being. The importance of promoting a positive attitude towards sexuality in old age also lies in how other areas of life, such as physical health and longevity, sexual intimacy, like other forms of physical contact, has beneficial effects on the health of the cardiovascular system, the liberation of endorphins, the reduction of pain, and the improvement of sleep. These benefits do not disappear with age. In fact, maintaining an active sex life can contribute to greater vitality and well-being. The practice of sexual relations can increase blood circulation, which improves the oxygenation of tissues and the functioning of organs, which favors healthy aging. Sexuality is also intrinsically related to self-esteem and the sense of identity. As people age, some may feel that their physical attractiveness decreases, which could generate insecurities or affect their perception of themselves. However, maintaining an open attitude towards sexual desire and the exploration of new forms of intimacy can strengthen self-esteem and helping older people feel that their body is still valuable, desirable, and capable of providing pleasure. The acceptance of the body itself, regardless of the changes that it experiences over the years, is key to enjoying a satisfactory sex life. If you want to discover the best advice I could give you, stay until the end of the video. If you like this type of videos, don't forget to subscribe to the channel so you don't miss more videos like this. As for the relationship, continuous communication is essential for both parties to feel respected and understood in their needs. In many cases, with age, couples may experience a change in sexual dynamics, but this does not mean that intimacy should be lost. Talking openly about what is desired and what is needed, without pressures or judgments, can enrich the relationship and strengthen emotional ties. Often, sexual satisfaction in old age is based more on emotional closeness and complicity than on the physical act itself. Likewise, sexual orientation and diversity of identities must also be considered in this context. The elderly, like any other person, have the right to explore their sexuality according to their desires and preferences. It is important to provide an inclusive and without prejudice environment, where everyone, regardless of their sexual orientation, feel validated and supported by their sexual experiences. Promoting respect and inclusion also helps reduce the social isolation that some older people may experience due to lack of understanding of their desires or needs. In summary, sexuality in old age is an integral part of general well-being, which can and should be maintained active and satisfactory. Instead of seeing age as an obstacle to enjoying a full sex life, we must celebrate that sexuality evolves, and with it, the opportunity to rediscover and experience new forms of connection, intimacy, and pleasure. Through open communication, physical and emotional health care, and a positive and respectful approach to desire and intimacy, older people can enjoy a healthy, enriching and satisfaction sexual life. It is also essential to recognize that sexuality in old age not only refers to the physical act of sexual relations, but to a broader spectrum that encompasses affective contact, emotional closeness, and simple pleasure of sharing intimate moments with a couple. For many older people, sexual desire is redefined with time and experience, prioritizing the emotional connection on the need to meet external expectations about what should be sexuality. Physical contact, such as hugs, kisses, and caresses, remains an important form of intimacy that can strengthen emotional ties and promote emotional well-being. Mental health plays a crucial role in this whole process. Aging can bring emotional and psychological challenges, such as fear of rejection, anxiety about physical appearance, or sadness for the loss of youth. These factors can influence sexual desire, so it is vital that older people take care of their emotional well-being as well as their physical health. Talking about these concerns with a couple of trust or with mental health professionals can be of great help to free any emotional barrier that can prevent a full sex life. In addition, couple therapy or sexual advice can offer useful strategies to solve problems related to intimacy, helping people feel more connected to their body and their partner. In addition, many times social prejudices play a role in the perception that older people have about their sexuality. The idea that sexuality is exclusive to young people is a stigma that we must constantly challenge. It is necessary for society to recognize and respect the sexual desires of the elderly, supporting an inclusive and open vision in which sexuality is celebrated at all ages. Education on the subject is also fundamental, since providing information and resources to older people about Sexuality, sexual health, and available options can empower them to make informed decisions and improve their general well-being. Sexuality can also be a key element in the construction of lasting and satisfactory couple relationships. In old age, many couples find that physical intimacy can adopt new forms or be less frequent, but the emotional connection becomes an even more important aspect. The closeness, communication, and mutual support are the pillars of a healthy sexual relationship in old age. While sexual desire can fluctuate over time, love and affection are constant that must be cultivated at all times. It is essential that both older people and society as a whole get rid of myths and misunderstandings about sexuality in old age. Sexuality is a human right that should not be limited by age, and must be seen as a source of well-being and joy, instead of focusing on physical limitations or what is no longer possible. It is healthier to focus on the possibilities that still exist to enjoy intimacy and connection with others, thus, by accepting the changes, but without losing sight of the importance of sexuality. The elderly can live a rich, full, and healthy sexual life that fosters both their physical and emotional well-being. As older people continue to explore their sexuality, it is crucial that they feel supported by their right to live this experience satisfactorily. Sometimes, changes in health can generate physical barriers, but this does not imply that sexuality should be limited or set aside. There are multiple options to adapt to these new realities, from physical therapies such as Kegel exercises, which strengthen pelvic soil muscles, to the use of devices that help improve erectile function or lubrication. These approaches, together with the willingness to prove new forms of intimacy, can allow sexuality to remain a vital and satisfactory component of life. In addition, social support is also an important factor. Older people can find comfort and understanding in support groups or in communities that share similar experiences. Talking openly about sexuality with others can help reduce the isolation that older people often experience by dealing with these issues. The inclusion of sexuality in social and family conversations is also a fundamental step to normalize it in old age, since this allows older people to feel validated and accepted in their desires and needs. In the context of public health, access to education about sexuality and sexual health is equally essential. Medical services must be prepared to address these issues with sensitivity and respect, providing older patients with the tools and resources necessary to maintain a healthy sex life. Health professionals must be willing to discuss openly about sexuality without judging, addressing any concern or question that patients may have, either about the use of contraceptives, erection problems, lubrication, or any other related topic. This type of professional support can be a key factor in ensuring that older people continue to enjoy their sexuality safely and healthy. In addition to physical and emotional aspects, sexuality also has a significant impact on the perception of life in general. People who maintain an active sex life, who feel that they can express themselves and enjoy intimacy, tend to have a more positive vision of aging. Sexuality provides a sense of vitality, self-acceptance, and connection, which contributes to greater satisfaction with life. By cultivating a positive attitude towards sexuality, older people may feel younger, more alive, and more willing to participate actively in life. Therefore, Maintaining healthy sexuality in old age is not only possible, but is an essential part of human life. As society continues to evolve, it is essential to knock down the barriers of stigma and encourage an inclusive and respectful approach towards the sexuality of the elderly. By making sexuality a normal and natural issue at all stages of life, the well-being and integral health of the elderly will be promoted, ensuring that they can enjoy a satisfactory and enriching sex life, regardless of age. Give the video a like if you liked it and subscribe to the channel so you don't miss more videos about this content. Leave a comment so we can know your opinion, and we will take it into account for future videos.